All right, so on this episode, we're going to be looking at the common misconceptions of acupuncture and dry needling. And I thought I'm going to start off, and we're just going to do like 5, 6. And I thought we'll start off with probably one of the most common ones, which is acupuncture and dry needling are the same. They're definitely not. They use the same tools, so we use the same needles, we use a sharp spin to put the same things in, but they are different. So they are different in terms of application, and they're also different about philosophical underpinning principles. So what we're doing with the needle in dry needling is we tend to be doing something very vigorous with the needle, and we're looking for responses ultra quick, 15, 20 seconds, okay? So we find we're doing really quick, rapid movements. It's often a very, very, very strong stimulus as well. So people are like, they really know they're getting it done. The technique is like ultra quick, and you're expecting to see changes like very, very rapidly. But what you don't expect with dry needling is to see any carryover. So you generally speaking with dry needling get a really good response, but with perhaps within an hour and a half, you'd expect the problem, the trigger point to come back. And the difference with that, we'll say with that and acupuncture, is that with acupuncture, we're expecting longer term benefits. We're expecting different sensations, and we're certainly not expecting like super strong sensations. Although you can get strong sensations, it's very different to what you'd get with dry needling. I guess the other misconception which is linked into this is that there are some people who think dry needling means Western acupuncture. It does not. Dry needling means needling a trigger point. Western acupuncture is still needling acupuncture points, but your explanation for why you're needling those acupuncture points comes from a Western philosophical perspective. So we talk about things like nerves, nerve roots, dermatomes, impact on certain areas of the brain, things like neuropeptides and the physiological response to needling as opposed to yin and yang and qi. So I think one of the big misconceptions is that people say dry needling is Western acupuncture. It isn't. Western acupuncture is still needling acupuncture points, not necessarily trigger points, but from a Western physiology perspective as opposed to a traditional Chinese medicine perspective. The second one I think is a misconception is around depth of needling. Some people think, and we see this really like in the early days of training, is that like deeper is better. Now, in some instances in life, that is supposed to be the truth, right? Deeper is better, but not necessarily in acupuncture. Your depth is very much dictated by the sensation that your patient reports. So we're looking for Tai Chi. Now, that could be like really, really superficial. In fact, Japanese style acupuncture, the needle is hardly in. It's like just the tip of the skin. It's almost the needle's falling out of the skin. All right. So the Japanese approach to acupuncture is not about going in depth and getting Tai Chi. It's about the needle just barely in, just kind of like sitting on top of the skin. So I wouldn't say that more needling or more depth is better. I don't think more needles is better either. So we kind of talk about like 7 or 10, right? 7 for unilateral, 10 for bilateral. You can increase your dosage if somebody isn't making a difference. So if they come back and they say like, my symptoms are no better, okay, we can go and increase your dose. But don't be going into like 20, 30 needles. I remember years ago, one of my colleagues had asked for an opinion on a patient they were treating, and I went in and you're like, they just like emptied this box of needles on top. That was like, I don't know, 30 odd needles in them. And that's just not the case. You see it on TikTok, you see it on YouTube videos and stuff, but that really is just for show. So more is not better. All right. So you kind of like really drill down to keep it to about your 7 or 10. Number 3, acupuncture is only for pain. Now, this is an interesting one because in traditional Chinese medicine, although pain is important, it's certainly not the only reason that you'd be doing acupuncture. And I think if you were talking to traditional Chinese medicine practitioners, they would talk about pain, but they would equally talk about things like well-being. They'll be talking about all sorts of bodily functions, psychological aspects. But in Western terms, and so if you're talking about the healthcare professionals, I guess if you're talking about the people who've had acupuncture in the past, it's most often here in the UK anyway, it is for pain. And I think that's driven because where most of the evidence base for acupuncture sits is in the pain relieving sphere, right, or the pain relieving space. So if we look at the big studies that are, robust and what have you, they're looking at acupuncture's impact on pain. So I can see why the misconception there is that, that's all we use acupuncture for. It's not. It has a fantastic impact on loads of other things. We've got a previous podcast on overactive bladder and how Emma, as part of her PhD, used acupuncture for overactive bladder. And that's not a painful, although it can be painful. The predominant symptoms aren't about pain. We have another group that we work with very regular on hot flushes. So again, that's not a painful condition, but it's something that is really, really effective. And I could keep on going on and on and on. So it's definitely not just for pain, although you will hear predominantly in the UK it being referred to for pain management. Acupuncture is just a placebo. There's absolutely no way I have time to go into all the nuances of placebo, but if we try to keep it fairly light touch, the definition of placebo varies wildly, all right? And clinicians who are very established and think they know what placebo is could be talking to another clinician, and actually when you get somebody to write down what is a placebo, they have wildly different interpretations. My interpretation of a placebo, or how to define it, is when somebody gets benefit of symptoms and we don't know why. So we're going to keep it really nice and broad like that. And I think that applies to almost everything that we do. So almost every intervention we do has a potential placebo element to it because we don't know why all interventions work. So paracetamol is a really good example of this, right? Paracetamol, we don't actually know why it works, but it does work. Interesting that we don't have that in the placebo argument, by the way, but nevertheless, there we are. But exercise, certainly from my profession, exercise, manual therapy, education, they all have this, we don't know why it works, but it does work element to it. And I think that if I'm talking to somebody who's not as bothered about the minutiae of what a placebo is definition-wise, right, as in most people who have a life, I kind of point to the evidence base and say, look, when we look at very large studies that have looked at outcomes over a set period of time, 3 months, 6 months, 9 months, 1 year, we know that acupuncture does seem to have a positive influence on symptoms for longer than just like a day or a couple of days. So the big evidence I would point people towards are the Clarkson reviews for migraine and headaches. I would point people towards the big systematic review and meta-analysis in chronic and persistent pain. And you've got the nice guidelines that underpin those as well and support those. So particularly, again, if you're in the UK, and I appreciate I do all of this about UK-centric. If you are not in the UK and you're watching these and listening to me, get in touch because we can talk about it from where you live and where you work. But yeah, in the UK, the nice guidelines do drive practice. And for headache management and for persistent pain, acupuncture is recommended. So I think if we're using the word just placebo, it's usually in a derogatory sense. We don't use those phrases and words for almost everything else, but acupuncture does get thrown into that. But I think we've got a good enough evidence base to say, it's probably not just that, because we do have an understanding as to how acupuncture is working, and it does seem to work. And then the final one is that anybody can do acupuncture. Now, this is both a misconception and a truth, in that actually, because acupuncture isn't a regulated profession in this country, actually anybody can use acupuncture. But that is certainly not something that I would advocate. And I think defining whether somebody can use acupuncture or not by their length of training is a really outdated way of doing it. And I say this coming from a position of worked in the university in senior positions of looking at, what makes good education. And I think defining it by how much contact you've had, it's just not the case, right? Different people have different learning styles and different approaches. We offer a really comprehensive package. Although our face-to-face training is, say, like 3 days, the online components of that, there's loads of it there, okay? Loads and loads and loads of stuff to guide people through learning. And, technology helps us to train better. What I would say is, though, that I don't think anybody should do acupuncture. I think what you should be looking for is having some robust training that focuses on safety and obviously effectiveness, but it really has a strong emphasis on safety. And unfortunately, there are adverse events, serious adverse events that happen, and it's usually when people haven't had that thorough training, and perhaps the training that they had hasn't gone into enough about the safety, or it hasn't covered enough depth about what an acupuncture is versus dry needling is, that kind of thing. So that's my probably top 5, top 6 misconceptions about acupuncture and dry needling. As always, in all of our podcasts, I want you to like, comment, and share. It makes a monster difference. And that's why I say it at the end of every podcast, all right? If I didn't think it was important, I wouldn't say it, and I wouldn't waste my time and my breath saying it. But it makes a massive difference. I want to hear from you. You know, is this working for you? Is the format good? Would you recommend some changes? What do you like? What would you like to see more of? Any of your comments, any of your thoughts, sharing it with your colleagues and your friends, it will be much appreciated. Thank you. I'll see you in the next episode.